2 years ago today, Superstorm Sandy slammed into the New York metropolitan area in what would become one of the worst natural disasters in U.S. history. Today, here on episode 85 of The Crisis Show, we'll look back and talk about some of the lessons learned for business and for government and the public regarding emergency management, business continuity, and communications. Good afternoon from New York. My name is Rich Klein of Rich Klein Crisis Management. I'm founder and host of The Crisis Show. Today, I'm pleased to have as my guests two experts in business continuity and emergency management. First of all, from Fort Worth, Texas, he's a regular on the show, a real expert in his field, and a good friend, Mike McKenna of Team Solutions. How are you, Mike?
Nice to see everybody. Good
to see you. And from Long Island, which got hit really hard, my hometown area, Lynn Maloney, who is the president of Advanced Egress Solutions, coming to us from Bethpage, Long Island. How are you, Lynn?
Good, good. How are you, Mike? Thank you for having us.
Good, good. Pleasure to see you. So, folks, right before we came on air today, literally just a few minutes ago, Governor Andrew Cuomo of New York issued a report on the state's recovery from Superstorm Sandy, and I did not get a chance to read it because it just came out. But I do have a news release here and some of the highlights. I want to just grab some of these highlights quickly, and we'll talk about some of this. As many as 300,000 housing units were damaged or destroyed, 2 million utility customers without power, 2,000 miles of roads affected, and of course major disruptions of public transportation. Tragically, a total of 61 people died in New York as a result of the storm. That's just New York, of course, and New Jersey, as we all know, got hit equally hard. The city of New York got hit very hard, of course, particularly in Staten Island. So the entire New York metropolitan area, one of the most densely populated areas of the United States, was affected by the storm. So, Mike, I want to start with you. Talk about the importance of how do you, as a business, when hit with a storm like this, what are some of the things you could do in advance of a crisis like this, and what are some of the lessons learned from Sandy? Where did small and large businesses go wrong in their planning or lack thereof for such a disaster?
Yeah, thanks, Rich. That's kind of a full topic. For starters,
take any piece of it you like.
No, I'll do my best. Responding successfully to a disaster and getting on the far side of it successfully. If you look at it from a scale from 0 to 100, 0 is everything's fine, you're in your ivory tower and there's no problems. The 100% solution is, in my view, pretty much unattainable. So the absence of a perfect plan is not an indictment against you or your company. And again, I'm speaking to the folks that are dialing in because they're concerned about their response to this. The goal, though, is to not stay at 0% of the solution. You want to get to as far down that sequence of response as possible. And by doing that, as you mentioned yourself, and Lynn will reinforce, I know, is the importance of an effective plan. Now, the plan itself, as we know, is not going to be nearly as valuable as the process of planning. And the process of planning starts, as it always should, with very clear, very measurable, and very strategic objectives. And so those objectives are, what do we want to see from ourselves if something big, bad, and ugly were to happen? And most of the companies that tend to go wrong isn't that they don't have the fuel, and they don't have the little go bags, and they don't have the phone list, and they don't have all those parts and pieces. It is the lack of very clear strategic objectives so that everybody knows what it looks like when they get to the far side of that obstruction. One of the statistics that we had shared earlier that I'll share with the audience is the amount of money that was spent on individual and government assistance, and it was $6.5 billion. That's a lot of zeros that was spent to help people on the backside of one of these incident. However, only 1% of that, equaling $85 million, was spent going forward on mitigation. So,
Mike, was that for the entire area hit by the storm, or was that just a particular area? That number you're talking about?
As far as I know, that's a FEMA number, and that is that is strictly referring to the United States. Now, we do know that the Caribbean was hit, and it involved loss of life, and also Canada was hit, and it involved loss of life. But my filter is basically because of the information that I was able to glean is from the U.S. perspective. So the steps involved in order after you have that strategic objective is to look at it from a how big and bad is this going to be, and the news is a source, but it is not the only source to determine how big and bad it's going to be. There was about 7 days notice from the time this thing turned into a hurricane down in the Caribbean before it was anticipated that it was going to make landfall along the eastern seaboard. So anticipating what big and bad is, my challenge to the companies is to broaden their definition of what that means. Because even if we have a plan that says that we are going to evacuate, let's say, from the inside of our building to the outside of our building, that's a great plan for a small-scale incident that involves a fire in a trash can or something. But when you have something that affects multiple states all along the East Coast, then evacuating that building involves a lot more strategy and operational support to get from there maybe to Wichita, Kansas, where you can be, high and dry. And so a robust evacuation plan that is flexible, I think, is another key aspect going forward. And the reason that we want to put effort into evacuation instead of sheltering in place is because when we have something that is so widespread, we want to move away from the belief that we can recover from a disaster from within a disaster. That generally does not result in a positive outcome. So in very few instances will I advise someone to plan on staying put. Most of the time we want to make sure that we have a plan to move to a better place.
Hey, Mike, can I talk to you for a second? This is a great conversation. I remember from previous shows on Sandy that you were, as I recall, involved in some of the efforts in Hurricane Katrina. Is that correct?
That is correct.
Yeah. So what I'm curious about, Mike, and maybe for our audience is, Katrina was 2005. This was 2012. 7 years between Katrina and Sandy. Do you have any explanation or understanding of why we as a country, government, business, individuals, families, didn't learn those lessons from the disaster that was Katrina, and that was in some ways just as horrible in terms of loss of life and so forth?
Quite simply, it's not in my backyard. We recognize from watching TV that it is a problem, but until it actually, until we're having to, pardon the expression, pee and poop in a pickle bucket for 5 days, we don't really see it as our problem. So I think that's a big part of it. Institutionally, we learn a lot of the wrong things the wrong way as opposed to trying to extract the lessons, which is one of the reasons I see this show as being so valuable, because that's exactly what our purpose is to identify those key lessons learned. Let's extract them from the big, bad, and ugly incident, and let's provide them to the masses in a way that they can say, you know what, if this were to happen to me, these are the steps that we can take to not be in that same boat.
Yeah, and Mike, on the first responder side, which I know you're also involved with, what's going on with the first responders around the country, around storm-related, evacuations and damage and so forth? Any training that's going on that's changed since Sandy?
Yes, I'd like to think that we're getting better at it. I think the training is more prevalent. It's more available. The response community is getting a lot smarter, a lot more prepared. And it used to be that the large incidents were responded to only by the large organizations, such as my own. But that's not true anymore, which to me is a good thing, because now a lot of the tools, the equipment, the skill sets, the capabilities is available, and it is robust at the local, regional, and state level. So when you have like tornadoes that we had last spring in Arkansas, where there was a federal response, the federal response frankly was not needed because the local, regional, and state response was so capable. Interesting.
Lynn, I want to turn to you. For our viewers' benefit, Lynn lives on Long Island. She was a volunteer in Nassau County in the immediate aftermath of Sandy, in terms of and helping out with some answering phones and communication. So, Lynn, maybe give us the big picture for our viewers who don't really know the New York area, may not understand Long Island. Of course, I grew up there on the South Shore, which was hit the hardest in New York State. Talk to us first of all about the big picture on Long Island in terms of the areas that were hit and the kinds of calls that you took during that time that you were fielding those calls for the county?
Sure, sure. So basically, Long Island is an island, okay? A couple ways on, a couple ways off. Unfortunately, about a year before that, we had Hurricane Irene. So the whole atmosphere was that, oh yeah, sure, it's going to be nothing. Hurricane Irene, we were threatened with on Long Island, and I also had volunteered at that time in CERT, which is the Citizen Emergency Response Team, and that operates out of the Office of Emergency Management in Nassau County, but they have them all over the state and pretty much all over the country. I was answering phone calls for Hurricane Irene, and we were advising people in low-lying areas, it might be a good idea to evacuate, get supplies, blah, blah, blah. Well, it wasn't that bad. So now when you had TV telling you that, something else was coming, people really laid back. They didn't believe that it was going to be as bad, or they didn't believe that it was really going to happen. One of the things that we talked about, well, I'll go into the phone calls. So basically, yeah. I started taking phone calls, people saying, well, what do I do? Where do I go? I don't know what to do. Or somebody that maybe had someone in their home that was on a ventilator or needed electricity that maybe didn't have a generator. So I have to say our Department of Health was wonderful. We would send those calls over to them, and they already had MOUs, which are memorandums of understanding, with local companies so that they were able to get generators to these folks so that if the electric went out, these people would still have a means of operating their respirators or whatever else they had going on.
Let me interrupt you 1 second. You took these calls before the storm hit or after or both?
Well, I did it for like 4 days. Before and after.
Okay, this is helpful.
Yeah.
Just for some timeline here. Yeah.
Yeah. So people were just asking, what should I do? What should I do? People were just helpless. And then also a big part of this was a lot of people that had mental health issues were really having a difficult time with this. And, us as volunteers, I just tried to talk them down and calm them down as best I could. But it really affected a lot of persons with mental health issues. So now fast forward, the storm has happened. And even right before the storm happened, people were calling in trying to find their loved ones. They would try to get in touch with somebody that they knew that lived on the island. They weren't answering the phone, or they couldn't get in touch with them for one reason or another. So we started taking lists of who was missing and whatever contact information they could give us for that person. Many of the people were elderly senior citizens who maybe lived in an assisted living or a nursing home. And what happened was some of the nursing homes in the low-lying areas were evacuated, but the information coming to us of who was evacuated was slim to none. So as we got the information, we would call the intake if they were transferred to a hospital or another facility. We try to call them, get the names of who came in so that we could cross-reference the lists, to try to find where these people were, because a lot of the people, unfortunately, suffer from dementia or Alzheimer's. They didn't even know who they were. So, right. That was a huge, huge issue. And just on a personal note, if you have a loved one in a nursing home or an assisted living and there's going to be an emergency, just go get them. Let them stay at your house for a day or two if your house is safe.
Yeah, don't depend on the nursing home or assisted living to do what they're supposed to do.
Yeah, people kept calling, where's my mom? Where's my mom? Well, and I'm thinking to myself, why didn't you just go get them, right. And let them stay with you for a day if they're, granted, if their health issues weren't that bad that you could handle them for a day. It was very upsetting. Another incident that I thought was upsetting was that we have so many box stores on Long Island. So
before you get to that, actually, I want to just stay on this point about
sure.
It goes to healthcare and hospitals. You talk about just for you sent me an article in our pre-show about these new regulations for hospitals having to be prepared. And for our viewers' benefit who may not remember, Long Beach, New York, Long Beach Hospital the physical structure is still there, but it's no longer in operation. Sits right on the canals of Long Beach on Long Island, and that was flooded out totally. Contrast that with Bellevue Hospital. I'm sorry, NYU Hospital in New York City, where we saw images around the world of these nurses carrying infants down the stairs to save them because of the East River flooding into Manhattan. So talk to us a little bit while we're on the subject of, assisted living,
Right, right.
care in hospitals. Talk to us about these regulations you mentioned to me.
Sure, sure. So Medicare and Medicaid, recognizing that, after Hurricane Katrina, all these different instances where people, basically it was difficult for them to be cared for. They've proposed new regulations having to do with emergency preparedness, and basically any healthcare facility that's reimbursed by Medicare or Medicaid will have to be in compliance. And some of the things that it covers is being able to shelter in place. If it's safe to do so, you have to make sure that you have adequate supplies on hand. You have to have a comprehensive emergency evacuation plan that you are going to carry out. You can't depend on the local first responders to get you out, because they're probably going to be busy doing 1,000 other things. You have to have emergency evacuation devices on the premises to be able to get people out safely and quickly. There's about 15 different things that it covers, but basically it all has to do with emergency preparedness. And the feedback from the healthcare community is 99% positive. Yeah, we need to do this. We should be doing this. It's common sense. So I'm very happy that a federal agency has recognized this and is going to, take it to the next level. Going back to NYU and the hospitals here that had to evacuate, I've been working with several of them because they want to be able to do it better. They're taking the lessons learned. One of the hospitals that I work with is Sloan Kettering, and what they determined was, we need to have a way to get every single patient out in an emergency. So what Sloan Kettering did was invented something called a vac in a box, and basically what they did is they put a box on every single hospital bed carrying that has a disposable evacuation sheet and a Mylar blanket to cover the patient. The idea is that in an emergency, the nurses will put the person on the blanket, on the disposable blanket, onto an evacuation device, get them outside. What we all saw in the street at NYU, where the EMS guys are trying to lift patients out, this is much easier. Just take the disposable blanket, which has handles, put it on a stretcher, strap them in, go. You can now use your evacuation device for the next person, and it also addresses infection control. Right. So they're one of the first hospitals to do this, but many of the other hospitals are on board. We also presented this to the Joint Commission, which is a governing body for hospitals, down in Orlando in May, and everybody loved it. Thought, a simple idea, just have something to get people out quickly.
Yeah, I guess the point there, and thank you so much for these stories, that they're really helpful to our viewers, I'm sure. As great as the New York City Fire Department is in rescue, I guess the lesson here is in a crisis like this, and of course we all saw this in Sandy, where first responders, because of flooded roads and being overwhelmed, they could not get to everybody, certainly like they would have loved to, I'm sure. And so therefore, it sounds like what I'm hearing from you, Lynn, and Mike, you could pick up on this, is really the responsibility, if you will, of institutions to take the lead in rescuing their own people. As hard as that is, that may not be in their job description, right? But this is becoming more and more important. So can you guys talk about that a little bit?
Well, number one, it should be in the job description. We're not suggesting that someone that's in the widget.
It is. I'm just, yeah.
No, I hear you. But I wanted to capture that statement because a lot of people, even though they may not say that they're in the business of rescuing their coworker, it goes back again, like I said, is that strategic objective, and that is we want to sell as many widgets as we can to as many widget buyers as we can, but at the same time, we want to be here tomorrow to do the same thing, and we can't meet that objective unless everyone shows up happy and healthy. So however that cat gets skinned, it really should be infused in the objectives that organizations have, so that when something other than normal business happens, they actually have some way to fix it. you're right. There is this expectation that 911 is going to fix these problems for us. I'm glad, and I think Lynn did an excellent job explaining the Medicare headlock that they're going to be putting on people if they don't kind of take care of their own stuff. In addition to the regulatory requirements, I think there is a moral requirement that if we can help, that we should help. Now, that requirement exists for all of us, but it certainly, I think, is enhanced if we employ people and if we are a member of the community. So I don't see it really as an option. I think we have to, whether we do a little bit or a lot, I think we have to recognize that we're responsible for ourselves and our people, whether we end up calling 911 or not.
Lynn, from your work, I just wondered, what was your sense of some of the in the healthcare community about that responsibility? Was it enthusiastic? Was it positive? Did you get pushback? Did they accept that responsibility willingly when these things are discussed?
Oh no, they absolutely do, and they, a lot of the people I talk to, nurses, say we just need the tools to do it, to get this done. But you have to realize it's not only the patients, it could be visitors, it could be tenants in the building.
Right.
Basically you have to be able to get out any patients, your employees. You may have a pregnant nurse who now can't travel, 10 flights of stairs. It could be anybody. Could be anybody.
Right. Yeah, one of the other things we talked about in the pre-show was the subject of fuel. Of course, here in New York, we all remember the shortage, which gave me reminders, I'm giving away my age here, of the 1973 energy crisis, people waiting in line for gasoline, which typically...
Did they have cars back then, Rich?
What's that?
Did they have cars back then?
You'll get yours. I'm going to come see you in Texas, beat you up. Yeah, they even had iPhones, Mike.
Wow.
Yeah, so we talked about this. This was a real crisis, certainly. The barges, the tankers couldn't get in to the New York City area. Lynn, you know a little bit about this, I think. So you had talked about one of the issues involved here. Can you just, for our viewers' benefit, talk to us about some of those issues that have been worked on?
Sure. Sure. So what was happening, I'm just going to backtrack a little bit, when I was answering the phones at the Office of Emergency Management, is that we had a lot of nurses and doctors who needed to get to work who didn't have gas. So the problem was the gas stations, not having gas or not having electric to pump the gas. So one thing that came out of that is that there's a new a new state law, I don't know if it's a law or regulation, that gas stations within a half a mile from emergency evacuation routes must have a transfer switch. And what the transfer switch does is allows them to switch over to a generator. But the thing that really irks me is that they have 24 hours to get up on generator service. They don't have to have a generator. So on my local news show this morning, there was somebody from a BP gas station, a franchisee owner, talking about, yeah, look, I put in the transfer switch, and if there's an emergency, I need to call BP, and they're going to get me out a generator. But, you're back to the same problem again. So if the roads are washed out, and there's no electricity, and you can't go back and forth on the bridges, how are you going to get that generator? It's just ridiculous.
Very interesting. Hey, Mike, I don't know I know on Long Island, if you live, I don't know the exact distance, but if you live in an area, a low-lying area, there's an evacuation route, the emergency route to get off, for example, get out of Long Beach to get away from the South Shore. I don't know if they have that in Texas or other places, but this is, I guess, particular to coastal communities, right? So I think that's what you're referring to when you talk about the location of the gas station. That's a really interesting point. I think I also read this morning from Governor Cuomo's website, he's releasing a whole bunch of stuff. Of course, he's up for re-election very soon. On that subject, staying with the subject of fuel reserve, Governor Cuomo today announced the establishment of a strategic fuel reserve at 6 key locations in upstate New York to help ensure that gasoline and diesel fuels are available to emergency responders in the event of emergency, including future storms. And he's located these locations in Rensselaer County, Brewerton, Rochester, Marcy, Vestal, which is near Binghamton, and Buffalo. He's calling it the Upstate Strategic Fuel Reserve Program administered by the New York State Energy Research and Development Authority, with $10 million of funding provided by the New York Power Authority. But again, I guess it goes back to your point, Lynn, is about the generators. You may be able to solve part of the problem, not the entire problem, right?
Right. Well, if you, what it said is it's a reserve for first responders. It's not going to be for the general public, first of all. And second of all, I guess that they're trying to adjust the fact that they, what had happened was a lot of the fuel reserve locations on Long Island were flooded out or out of service. And then also the Coast Guard closed the harbor. So you couldn't use supply A, and now you can't use supply B. Right. So now they're going to C.
Interesting.
Which is true. What we found a lot in Hurricane Sandy was even if a company had a comprehensive plan, one company in New York City, who's actually a governmental agency, a person, the emergency manager told me that she had 4 people in line. So if there was an emergency and she wasn't available, then we're going to go to B, we're going to go to C, we're going to go to D. Do you know that it went down to 16 people in Hurricane Sandy because, you know, people either had no electricity, she couldn't get in touch with them, or they had no way to get in if because public transportation was completely out. So they had no way to get, even if they wanted to go to work, they had no way to get to work, which I don't know if you want to talk about cell phones, but that seemed to be texting was the best method of communication because you can charge your cell phone in your car.
If your car's not flooded out, of course, right? Right.
So even if there's no internet connection, you can text, and that's what that was the main method of communication at that time.
Yeah, Mike, we've talked on the show, and please jump in here. I like some of the things you've said on previous shows about communicating in a crisis. You know, some of the methods that you first responders use and have relied on. So talk to our viewers a little bit, Mike, about some of these tools that do work, some that don't, and some suggestions for business.
Standing on the tallest building you can, and you saying, "Hey, you! I need you over here." It's helpful, but it's probably not the most helpful. I like the question. I would like to go back briefly to the fuel reserve thing before I forget it.
Sure.
Okay. So let me illustrate to the viewers likely how that came about, and here was what my fear is. And I'd like to be wrong, and I'm happy to be wrong about this. So Hurricane Sandy hits 2012. A lot of people have a lot of things to say afterwards. They do what's called an AAR, so an after-action review. And that is everyone gets together and they cuss and discuss what went right, what went wrong, and what needs to improve. So then after that, they create a document that is something similar to what's called an improvement plan, or an IP. So the improvement plan says, all right, we need to go fix A, B, C, and D. And one of those likely was we need to have fuel reserves. Okay? So that then generates a new objective. And the objective is, okay, Johnny, go build us fuel reserves. Go establish fuel reserves. So that was probably the, or I'd like to see that I'm hoping that happened. So then Johnny goes out and creates these fuel reserves, but the problem is that he was given that as a task, and the task is done in isolation. What my fear is that they checked their box, they did their press release, they pat each other on the back, and they have fuel reserves, but in the absence of, and here I go again with that strategic objective, with the absence of that, they don't understand how the fuel reserves need to play a part in the larger picture. So my fear is that tomorrow, if something big, bad, ugly happens, they're going to be looking at these fuel reserves, and they're not going to have a truck to drive the fuel reserves to the place they need to go. They're not going to have a driver because the driver is underwater in his or her house. They're not going to have the roads cleared in order to get those fuel reserves. And like Lynn aptly pointed out, they're not going to have a generator to fill or a fuel tank to fill because the proper equipment isn't there because it's lost in some email sent over to Europe to bring us a generator. So that's how these things fall apart. It's not the absence of the plan, it is the planning process that is poorly constructed on poorly conceived objectives. So that's my soapbox. Hopefully I don't get any splinters climbing off of it.
Yeah, I guess what you're saying, Mike, is people are doing the best they can with the planning process, but they're not planning for the red tape or glitches that and the worst case scenarios, right?
Well, the easiest thing to say is that they're not planning for the big picture, but the big picture needs to have some definition and refinement to it. Otherwise, you're stuck with all of these stacks of press releases and plans that we have fuel reserves over here, and we have this road clearance plan over here, but they never touch and they never are implemented. And even if they are, and I know I'm kind of a naysayer here, but even if they are implemented or integrated, rather, they tend to be integrated at the local level. And that's great if the problem is confined to the local level. When you have the entire East Coast and you have not only County A and County B involved, but you also have State A and State B involved. And they, if the first time they ever get together in the same room to come up with how are they going to distribute fuel, if the first time that conversation happens is when there's a million cars and people dying on the road because they're out of gas, then someone has failed. And they failed today when it's bright and sunny outside, because that's when those discussions need to occur.
Yeah, I will get back to you on the communication side, but actually it just brings me another point. Lynn, Mike put up a good point about, different locations. So Long Island, Nassau County, Suffolk County, what was your sense of the cooperation between the county executives and government, local government officials around the island during that time?
Yeah. They were constantly going back and forth, but as I listened to Mike speak, it reminded me of a phone call that I took. So Home Depot called the Office of Emergency Management and said, I got 20 trucks sitting here. What do you need? And, so I passed along the message. Everybody's like, oh my God, that's great. So that led me to believe that there was no MOU or previous plan in place to move things. So thank God that the person from Home Depot, the manager, whomever, called and said, hey, I got these trucks sitting here. Can I help you guys out at all? What can we do to help?
Right.
Now, perhaps there was a previous arrangement, but it didn't really sound like that. Another thing that Mike made me think about was that we had a lot of difficulty evacuating people who had pets. People will not leave their pets.
They won't, right?
So, all the shelters.
The kids, but not their pets, right?
Right. All the shelters that were set up, people wouldn't go because they wanted to bring their pet. So, actually, in Nassau County, we do have a pet shelter. And the people want to go with the pets. It was a nightmare, like you wouldn't believe it, which, I guess I understand you don't want to leave your pet, but that was the biggest thing. People would not leave.
Interesting. Very interesting point. So I guess you did see good cooperation, I guess.
Between? Yes.
Okay.
So Rich, you said, let me pick up on something that Lynn said.
Katrina.
So in 2012, people there was still a lot of friction over what to do with Fifi the Wonder Dog, their little pet. 2005, that was obviously a significant problem in Katrina, and I know we've talked about that on the show before. 2006, the fastest law in the history of laws was passed, called the PETS Act, P-E-T-S. Don't know what it stands for. That required responders to make an accommodation for Mr. and Mrs. Smith along with Fifi, their dog, as opposed to only dealing with Mr. and Mrs. Smith. That was 2006, and that has been pushed out. One of the classes I teach for a public sector agency, that's a key part of that class, and I probably taught the class 100 times. So I know that there's a lot of people that have that information, and they have had access to that information since the law passed in 2006. 6 years later, 2012, as Lynn just said, people are not evacuating because there's not a plan for the pets. So going back to your question, why is this a continual problem? Simply, we don't make the connective element that because we see it on TV and it happens to someone on the south border of our country, that means that we're somehow insulated if we live on the northeast boundary of our country. It really is shameful that these lessons have to continue to be relearned, because when you don't take, we all love our pets, right? And so if you don't make an accommodation for my little Fifi dog, then I'm going to make a bad choice, and I'm going to stay in place, and I'm going to succumb myself to injury, and I'm going to stay part of the problem because you don't have a plan for me and Fifi, and it's really shameful.
Ours was separate, so it was, there were human shelters and then there were animal shelters. And what I also thought was interesting was a lot of people did not come back for their pets. So you don't know, because what happened was, let's just say, God forbid their home was wiped out. Maybe they had to rent an apartment somewhere, or, our motels and hotels were full full for months and months, maybe even a year, with people who
Still
have.
going on. There's the stories I read today. There are a lot of people, and our prayers go out to these people who are still 2 years later struggling to get back in their homes or to find another home. This is still going on from what I read, which was a real surprise. Yeah. But go ahead. I'm sorry.
Well, and you had
I was
what
just
was your
saying that, I assume that a lot of these people.
earmarked? But then you said 600 projects have been requested, and only 10 of them or something have been funded.
25.
25. Wow. Okay, at least double digits. Right?
Yeah. Yeah.
Yeah, I could say that one of the things that we learned here in the Northeast, we always would hear about someone. Mike, you made a great point. We always heard about someone else's disasters, tornadoes in Texas, hurricanes in Florida, wildfires in Arizona and California, and I like to believe that this experience that the Northeast had with Sandy brings us all closer on the same page of understanding the importance of caring, love thy neighbor, if you will, caring for your neighbors first and foremost, and planning for the worst, which is what we talk about on the show all the time. And I think that Sandy was a lesson, and even though it's 2 years later, I guess Micah, maybe you could chime in on this. It seems to me in the Monday morning quarterbacking business, or in this review process you referred to, I don't remember the exact term. 2 years is a short time, and there still will be lessons learn from Sandy every year now going forward, right? I mean, we'll, like you said, it never is 100%, but we always need to find ways to improve the process, right?
Well, the lesson's already been learned and learned and learned and learned. So it's really more, lessons reminded, which is when we look at the hierarchy of how adults learn, it is the lowest form of learning. Is that we constantly have to be reminded. There's not any sort of ownership over it, and I think if we continue to kind of live with these dependent type policies that say, you call 911, I'm going to take care of 100% of your problem, then it de-incentivizes me to come up with a solution for my own problem. And that's how adults actually get ingrained with new knowledge and behavior, is they have to have some role in the ownership of it. So it's not that there's an absence of information. I mean, gosh knows, this is the 85th show, Rich. By the way, congratulations for that. And the ones that I'm not on, I try to watch, and they are filled with big brains and big information. And so the information is there. It's just a matter of, making someone own that information so that they themselves are responsible for solving part of their problem. I think that's how we turn this from a reminder type procedure to a actual lessons learned procedure.
Yeah, thank you for that. It seems to me every time we could bring business and government, nonprofits, the emergency management community together, that's going to help. But I very often I know, and Mike, I know you've seen this up close in your work, bureaucracy is sometimes getting in the way, and political differences, political agendas get in the way of getting the real work done. And I'm sure this, we see this all the time, obviously. But there's a hope that there is more synergy going forward with every storm and every tornado, every wildfire. I heard just today in Hawaii they have to worry about lava from a volcano now. So it's every day there's something going on in this country and around the world that requires people to think about some of the things that we're talking about here. And of course, we're hoping to get those messages across. But Mike, I wanted to wrap the show the next few minutes around the communications aspects of emergency management, and I know you, because it really fits in here. Talk to us a little bit about the best ways people can communicate in a storm like Sandy. How do first responders communicate with each other? How should victims of a storm communicate out to the world when they're stuck? What are some of the things you might recommend in a general way for the moment?
Well, it's certainly, I think the answer is that it needs to be in a general way. This video will live forever, and whatever we say today is going to be obsolete tomorrow because of the...
Maybe a couple of weeks, but not too long.
Yeah, exactly. How we communicate is the way that works, and the way that works is understanding a couple of key things. For you to hear it and to take action based on my words, we need to be in the same place. So whether that's, like Lynn said, a text, which uses a straw to communicate data, because it doesn't get clogged as easily, or rather, like a big fire hose as opposed to a straw, I guess is the analogy I was trying to make. They don't use as much data. But nonetheless, if I send you a text and you don't have a phone, then that text is going to be on deaf ears. It's no different than me speaking to you in a language that you don't understand. So the global statement about communication is that it has to be considered two-way, and that what I say is not for my benefit; it's for your benefit. So if I'm going to pontificate using the communication tool of my choice, and this is kind of the Twitter and Facebook thing, but my audience, the person who needs to hear it, is not there, then I've misfired the communication. So that's kind of how I think everyone should communicate. On the response side, federally they want us to have all these encrypted radios and all that kind of stuff. But the problem is that, like, I can think of one day in Katrina, those radios I think are $3,500 or something, and one of them went swimming. It just fell out of someone's hand and went down to the bottom of the cesspool that we were in. And so all of a sudden we lost the ability to communicate, and we didn't have any redundant communications for using text and that sort of thing because it wasn't encrypted. But without that redundancy, and I think you've heard me kind of emote on this in the past, that 3 is 2, 2 is 1, 1 is none. It's not just what you have; it is the number of ways that you have. And the last thing I would leave you with, that's a general global statement, is that the lowest form of technology tends to be one of the most effective. So if I need you to understand something, then perhaps I can write it on a piece of paper and leave that for you, because I am more confident that you're going to be able to see that without relying on battery power and that sort of thing.
Gotcha. Well, thanks for that. Lynn, you had some statistics I think you want to share with us about Sandy.
Sure.
Go ahead.
Well, about emergencies in general, so just a little bit of information. Harvard did a study, their emergency management department, to determine the costs of preparedness. So for every $1 I don't have it in front of me, so I'm doing this from memory, but for every $1 that you spend on preparedness, you recognize a savings of $7.
Wow.
During recovery. So there's a real savings there, and there's a reason to prepare. And the other statistic has to do with emergencies in general. When there's an emergency, 10% of the population will do the wrong thing. 80% do absolutely nothing. Only 10% of the population know what to do and get it done, and that's a little bit scary.
Yeah, that is scary.
So here would be my proposal, and I like that, Lynn, a whole lot. So for $1 in preparation and $7 in recovery, I'm not a math major, but I think that would mean that if we apply it to Hurricane Sandy, that for the $85 million that was spent in mitigation, that there should be a $63 million reduction in the $6.5 billion that was spent last year, or two years ago. So the next time, and when or if it does happen, the next time something big, bad, and ugly happens, I think we need to reconvene and see whether or not that $85 million spent in preparedness and mitigation actually has made a positive impact,
right.
According to Harvard statistic.
Right.
Okay. Any other closing thoughts?
This was a wonderful show. Thank you for having us. Enjoyed it thoroughly.
No, it was great having you, Lynn. It's especially because you were literally so close to this, and that inside information was very helpful to us, and I'm sure our viewers as well. For our viewers, this is I think the third show we've done on Sandy. Mike and I and a few others did a show in November 2012, a few weeks after. We'll have links to these on our website at www.thecrisisshow.com. That's one show you can check out. There was also a show on the first anniversary of Sandy. Mike was also there. And then Mike and I did a show back in March which about severe weather and some tips there. And some of the things you may not have heard today, you'll find from Mike on that episode in March 2014. So we'll put those links up on our website as well. If you'd like to tweet about anything you heard from the show today, please use hashtag The Crisis Show. You could also like The Crisis Show page on Facebook and follow us there for information. Mike from Team Solutions in Texas, look him up. Mike's got a great blog, and I think almost 7,000 followers now on Twitter. And that's at Team Solutions, right, on Twitter, Mike?
team_solutions, I believe.
As we see it here on the screen, yeah. Check out Mike. Follow him. He's always got words of wisdom, if I'm allowed to say that without getting copyright infringement. And Lynn, of course, at Bethpage, Long Island, emergency management, business continuity. Check her out. The name of your company again, Lynn? Can you pronounce it in case I get it wrong?
Oh, sure. It's Advanced Egress Solutions, and I really specialize in emergency evacuation products and emergency preparedness.
Great. Well, thank you both very much, and we will do this again a year from now and see where we are, okay?
I'm looking forward to it, Rich.
Thanks so much, guys. Have a wonderful day. To our viewers, thank you so much for watching. We'll see you soon. Bye-bye now.
Bye-bye.